Okay, good afternoon. My name is Friedrich Rheinfrank, and today's mini lecture topic will be on pneumonia vaccination. So, the takeaway for today, the objectives will be, by the end of this lecture, you'll understand the pathophysiology of pneumonia. By the end of the lecture, you'll be able to identify prevention options for pneumonia based on the CDC guidelines. And you'll also be able to explain the difference between community-acquired, hospital-acquired, and ventilator-acquired pneumonia. So let's discuss a little bit about the background of the disease. So pneumonia is still one of the most common causes of sepsis and infectious disease deaths in the United States. It has a mortality rate of between 30 and 40%. It is estimated that 150,000 cases each year kill almost 3,600 patients in the United States alone. The pneumonia organisms that cause this disease can be introduced in three different ways, either through inhalation, through the bloodstream, or through aspiration. Some of the common signs and symptoms of pneumonia can be abrupt fever with chills, productive cough, usually producing a bloody or a rust-colored sputum, and pleuritic chest pain. Okay, so some of the environmental factors that are important. Pneumonia can be classified by the way it's acquired. So the first way is community acquired, meaning it's acquired out in the community outside of a hospital. The second is hospital acquired. It's acquired within the hospital. And the third is acquired through a ventilator. So in other words, a patient who might be in ICU on a ventilator can acquire pneumonia. All three of these, the main bacterial cause, is Streptococcus pneumoniae, but each one has individual types of pathogens that can cause pneumonia. So, prevention options. Since the 1980s, we've had pneumonia vaccinations. The most common in the U.S. are the PPSV23 and the PCV13. The PCV13 pneumococcal conjugate vaccine was introduced into the pediatric immunization schedule in 2010. By doing this, they've had a drastic decrease in both adult and pediatric cases of pneumonia. So, for the CDC guidelines, for the PCV13, they recommend that all children younger than 2 years of age and all people 2 years of age or older with certain medical conditions should get the PCV13. Now, the PCV13 can be given to those patients greater than 65 if the combined decision making between the provider and the patient deem that it is a benefit to the patient. Some of the reasons they might want to give the 13 is that if the older patient is going to travel outside the United States, or possibly they might work in a child care area where it might be beneficial to go ahead and get that PCV13. Now, the PPSV23, the CDC recommends this to be for all patients 65 and older. Also, if there's any conditions, other medical conditions that might warrant this. Okay, so let's compare the two. Your PCV13, also called Prevnar 13, and the PPSV23, or Pneumovax. Both are for prevention. Both have some drug interactions, a very large list on the CDC website, but some of the common drugs might be Zostavax, blood thinners, and corticosteroids. They're both highly effective with around an 80% efficacy. They both do have some safety concerns that would be anaphylaxis because of certain components in the vaccine itself. The costs between the two average $188 for the 13 and about $105 for the 23. Both of them have an expected outcome of disease prevention. Now, the main difference between the 13 and 23 is PCV13 protects you against 13 of the most common strains of pneumonia, whereas PCV or PPSV 23 protects you for 23 of the most common strains of pneumonia. So in this next slide, you're going to see the adult immunization schedule. So this you can use to talk with your patients about and show them at what age range which immunization or vaccination might be most beneficial. Okay, so what were the outcomes of this lecture? Hopefully I presented to you information that you can take home and use in your practice. First off, just a basic understanding of the pathophysiology of pneumonia. Second take home is identifying prevention options of pneumonia. And third is explaining the difference between community-acquired, hospital-acquired, and ventilator-acquired pneumonia. And lastly, I've included the references so that you can research pneumonia more on your own. It's an interesting topic, and luckily through the use of vaccinations, we have drastically decreased the number of pneumonia cases in the United States and saved a lot of lives. So thank you for watching, and I hope that you have a great day. Thank you.